The explosion tore through the simulation bay at 9:14 hours, and Vesk Torelli knew immediately that something had gone wrong with the drill because the fire was real. He had been standing beside the portable triage station, adjusting the calibration on a borrowed pulse stabilizer, when the concussive wave slammed him sideways into the bulkhead. His field pack struck the wall first, absorbing part of the impact. His ribs absorbed the rest. For 2 full seconds, Vesk lay on the floor of Bay 9 and watched the overhead lights flicker between amber and dead black. And in those 2 seconds, the klaxon changed from the rhythmic two-tone of the exercise alarm to the single, sustained wail that meant real casualties. He was on his feet before his lungs had finished protesting. Around him, a dozen keth'vari medics and nurses were doing the same thing, ears flattened against their skulls, fur bristling, nostrils flaring against the chemical stink of burning polymer insulation. Vesk was taller than most of them, his ash-gray pelt marked with the silver throat stripe that designated a field surgeon, 4th rotation, keth'vari Combined Medical Corps. He had been running drills on this station for 11 days. Today was supposed to be the last day. Torelli, supervising clinician Merit Owen, was shouting from the doorway of Bay 9, her voice barely audible over the klaxon. She was a compact keth'vari female, her tawny fur darkened with soot, one ear torn and bleeding from shrapnel she had not yet bothered to address. The simulation charges in Bay 7 cascaded. We have a structural collapse in the training wing, fires in 3 compartments, and 17 confirmed casualties. This is not a drill anymore. Vesk grabbed his field pack and was moving before she finished the sentence. How many still trapped? Unknown. The monitoring net is down. We lost contact with the observer team on the 2nd gallery. The training station Pale Vashari had been built for exactly this kind of preparation. 40 kilometers long, a decommissioned orbital platform repurposed as a joint medical training facility. It hung in a stable orbit around Keth'vari's smallest moon. Every cycle, military and civilian medics from across the keth'vari compact ran mass casualty drills here, practicing the organized chaos of field medicine under conditions designed to simulate the worst. Simulated structural failures, simulated radiation events, simulated hull breaches with vacuum alarms and depressurization timers. None of the simulations had included the simulation charges actually detonating. Vesk reached Bay 7 in 90 seconds. What he found stopped him for exactly 1 heartbeat. The reinforced ceiling of the training gallery had buckled inward along a 20-meter seam. Support beams hung at angles, trailing cables and conduit like torn ligaments. Below the collapse zone, training mannequins and real bodies lay together in a confusion that would have been grotesque if Vesk had allowed himself the luxury of being grotesque. He did not. He counted heads. He triaged by sight. He moved. Cast 4 laceration left side mobile, he said aloud, pointing at a young keth'vari nurse sitting against a wall with blood matting the fur of her shoulder. Cast 2 crush injury, immobile priority. That was a male technician pinned under a section of fallen beam, conscious but unable to move his lower body. Cast 1, not breathing, immediate. A motionless form half buried in ceiling tile. He knelt beside the Cast 1 patient and began working. Around him, other medics arrived, and Vesk directed them without looking up, his hands deep in the field kit, his voice flat and steady. This was the part of the work he understood best. Not the rank structure, not the reporting protocols, not the 11 days of simulated scenarios with their tidy scoring rubrics. The part where everything had gone wrong and the only thing left to do was keep people alive until someone figured out how to make it stop going wrong. The Cast 1 patient was a young female instructor named Keth'vari Vol. She had no pulse. Vesk opened his field resuscitator, placed the paddles against the copper-furred chest and fired. Nothing. He adjusted the frequency for keth'vari cardiac rhythm, the dual-chambered pump that other species found biologically redundant until it failed and fired again. The body convulsed. A heartbeat stuttered, caught, and held. Keth'vari Vol's eyes opened. She stared at Vesk with the glassy, unfocused terror of someone pulled back from a place where there were no training drills, and no simulation charges, and no overhead lights flickering between amber and black. "You are on keth'vari," Vesk told her. "You are alive, do not move." She did not move. Vesk tagged her as cast to, stabilized, and turned to the next patient. 20 minutes in, the station's internal communications net came back in fragments. Vesk heard the chatter through his earpiece, distorted and overlapping. Bay 7 was the worst hit, but Bays 5 and 6 had sustained fire damage, and the main medical ward on Deck 3 was being evacuated due to smoke contamination. The station's own hospital was compromised. Its surgical suites were offline. Its ventilation system was cycling toxic fumes through half the compartments on the port side. More casualties were being found. The observer team from the second gallery, 7 medics who had been watching the drill from an elevated platform, had been located. 4 were mobile with minor injuries. 2 were unconscious with head trauma. 1, a senior evaluator named Trenny Bask, had compound fractures in both legs and a penetrating chest wound that had been partially sealed by the pressure of the debris pinning him in place. Vesk dispatched 2 medics to the gallery with instructions that amounted to keep the debris in place until they could control the chest wound, then extract. It was crude. It was the best option he had. The command staff, Vesk gathered from the fragments, was still trying to determine whether the cascade had been accidental or sabotage. He did not care about the answer. He cared about the woman whose femoral artery was leaking under his hands, and the fact that his portable coagulator had just run out of charge. "I need a powered unit," he said to the nearest medic, a young male named Dren whose hands were shaking badly enough to be visible. "Deck 3 stores. Go." "Deck 3 is sealed. The smoke." "Then find another one, anywhere on the station. Run." Dren ran. Vesk held pressure with both hands and counted heartbeats. The woman under his hands was supervising clinician Owen. She had come down to Bay 7 to help, and had been struck by a secondary ceiling panel that had sheared loose 10 minutes after the initial collapse. The panel had opened her thigh to the bone. Vesk had been controlling the bleed for 4 minutes. Without a coagulator, he had perhaps 6 more before the volume loss became irreversible. He talked to her while he worked, not comfort exactly, information. "The bleeding is controlled manually. I have a medic retrieving a coagulator. Your pulse is steady. Your breathing is adequate. Facts, anchors, things to hold on to while the body tried to decide whether it was dying." Owen's eyes found his. "How bad?" "Manageable. If Dren runs fast." "He has never run fast in his life, Torelli." "Then today he learns." At the 5-minute mark, the station's general channel squawked with a voice Vesk did not recognize. Not keth'vari. The accent was flat, the consonants bitten short, the vowels oddly shallow. It was speaking in galactic common, but the cadence belonged to a language built for shorter sentences and harder stops. "keth'vari Station, this is the TRNS Callaway, Terran Relief and Neutrality Service. We received your automated distress beacon at 9:17. We are holding at 400 meters off your port docking assembly. Request permission to dock and render assistance. We have surgical teams, portable ventilation, structural stabilization equipment, and blood substitute stores for 17 registered species. How copy?" The voice was calm, not performatively calm, not the studied calm of a commander who knew he was being recorded. Calm in the way of a person reciting information they had recited before, on other stations, in other emergencies, to other species who had not expected anyone to answer. Vesk did not stop what he was doing. He could not afford to stop, but he heard the words, and some part of his attention snagged on a detail that should not have mattered. 17 registered species. The keth'vari compact included 6. The broader Concord included 11. 17 meant the humans had brought supplies for species that were not even in this sector. 40 seconds later, the station commander's voice came back, strained and too fast. keth'vari, permission granted. Docket Port Assembly 3. Be advised, our internal hospital is offline. Main surgical ward contaminated. We are operating from field stations in the training bays. Understood, Vashari. Calloway copies all. We are bringing our surgical unit to you. ETA to your deck, 6 minutes. 6 minutes. Vesk looked down at Merritt-Owen's face. Her eyes were half closed, her breathing shallow, her fur gone dull with shock. He had perhaps 4 minutes of useful pressure left. Dren, he said into his earpiece, where are you? Supply room on deck 4. The coagulators are locked in a trauma cabinet. I cannot get the cabinet open. Break it. The lock is. Dren, break the cabinet. A long pause, then the sound of something hitting metal twice and a third time with more conviction. Then Dren's voice, slightly breathless. I have 2 units. Run. The humans arrived before Dren did. Vesk had not been looking at the entrance to Bay 7. He had been watching Owen's pulse through the blood-slicked fur of her throat, counting the intervals between beats, calculating how many he had left. So when the shadow fell across his hands, he looked up expecting Dren. What he saw instead was a human woman in a gray coverall, with the red cross and crescent insignia of the Terran Relief Service on her left shoulder. She was shorter than Vesk by a full head, broad across the shoulders, with dark skin and close-cropped silver hair. She was carrying a field bag that was twice the size of Vesk's, and she was already opening it as she knelt beside him. Femoral, she said, 1 word. Yes, 4 centimeters above the knee. I have been holding pressure for 6 minutes. No coagulator available. She pulled a device from her bag that Vesk did not recognize. It was shaped like a thick stylus with a flared end, and when she activated it, it emitted a low hum and a pale amber glow. She placed it against the wound, directly beside Vesk's blood-soaked hands. Thermal coagulation with integrated clotting agent delivery, she said, as if reading his question from his face. Hold pressure for 10 more seconds, then release on my count. He held, she counted, he released, the bleeding stopped. Vesk stared at the wound. The tissue was sealed, not crudely cauterized, but sealed in a clean, precise line, the clotting agent visible as a thin amber film beneath the closed tissue edge. He had never seen field equipment do that. The best keth'vari field coagulators left scar tissue and required surgical follow-up within the hour. This looked like the wound had been closed in an operating theater. The human woman was already moving, her hands pulling a portable vital sign monitor from her bag, wrapping its sensor band around Owen's wrist. She glanced at the readings, then at Vesk. Her volume is low but stable. She needs fluids and monitoring. Can you stay with her? Yes. Good, I'm Petty Officer Quinn. My team is setting up a forward surgical point in your main corridor outside this bay. If her condition changes, call me on Channel 4. She was gone before he could ask anything else. Vesk looked down at the device she had left beside Owen's leg, the one that had sealed a femoral bleed in 10 seconds on a species the human had likely never treated before today. He picked it up. It was warm in his hand. On its side, in small etched lettering, were the words Field Use Universal Spec 17 Species Variant. 17 species. They had built the tool for 17 species. Dren arrived 90 seconds later, breathing hard, both coagulators clutched against his chest. He looked at Owen. He looked at the sealed wound. He looked at Vesk. What happened? The humans are here, Vesk said. Give me those units. We have other patients who need them. The next 3 hours were the worst and the best of Vesk's career, and the distinction between those 2 categories blurred so thoroughly that he would never fully separate them afterward. The Callaway's surgical team numbered 14 humans. They came aboard keth'vari carrying modular surgical suites that unfolded from cases the size of cargo crates into fully functional operating theaters in under 8 minutes. Vesk watched 2 of them set up in the main corridor outside Bay 7. The units had their own lighting, their own atmospheric filtration, their own power supplies. They had surgical tables that adjusted to accommodate body plans ranging from bipedal to hexapodal. They had instrument trays that contained tools Vesk recognized, and tools he had never seen, and tools that looked like they had been designed for anatomies that did not exist in this sector. "We carry a full multi-species kit," said a human surgeon named Kiro, a tall, thin man with a shaved head and a voice so quiet that Vesk had to lean in to hear him. He was scrubbing in at a portable basin that generated its own sterile water from atmospheric humidity. Keth'vari physiology falls under our category 3: warm-blooded, bilateral symmetry, copper-iron hybrid blood chemistry, enhanced coagulation response. "We trained on it." "You trained on our species." "On all 17 in our current deployment package. We rotate the package every 6 months based on sector assignment. This sector has keth'vari, Daelth, Vora, Pelin, and 3 minor contact species. We trained on all 7 before we shipped out." The first patient into the modular theater was Trenny Bask, the senior evaluator extracted from the second gallery. His chest wound was worse than the initial report had suggested. A shard of structural alloy had penetrated between the second and third rib plates, nicking the lower cardiac chamber and lodging against the pulmonary trunk. In keth'vari field surgery, the procedure to address it required a full thoracic suite, 2 senior surgeons, and roughly 3 hours. The station's thoracic suite was currently filling with smoke on deck 3. Vesk stood in the corridor outside the modular theater and watched Caro's team open Bask's chest. The lead surgeon was a woman named Hasford who spoke in a low, continuous murmur to her team, each instruction precise, each movement economical. The anesthetist monitored readings on a screen that displayed keth'vari cardiac rhythms alongside a human standard reference, the 2 waveforms side by side, the differences annotated in real time by a software system that was learning as it worked. The shard came out in one piece. The cardiac chamber was repaired with a synthetic patch that bonded to keth'vari tissue as if it had been grown for the purpose. The pulmonary trunk was cleared, tested, and sealed. Bask's chest was closed with sutures that dissolved on a schedule match to keth'vari healing rates. The surgery took 41 minutes. Vesk knew because he stood there for all 41 of them, unable to leave, unable to stop watching, and unable to articulate the thing that was building in his chest that was not exactly gratitude and not exactly shame and not exactly awe, but was somehow all 3 compressed into a single expanding pressure behind his sternum. He went back to work. There was too much of it to do anything else. The Callaway's team did not take over. That was the thing Vesk noticed first and could not stop noticing. They did not push the keth'vari medics aside. They did not announce superiority. They did not reorganize the triage system that Vesk and his colleagues had established in the first chaotic minutes after the explosion. Instead, they slotted themselves into the gaps. Where the keth'vari medics were overwhelmed, a human team appeared and took the overflow. Where keth'vari equipment had failed, human equipment replaced it, quietly, without commentary. Where keth'vari surgeons were performing procedures they knew, the humans stood back and watched and said nothing. Where the injuries exceeded what the keth'vari field kits could handle, the humans stepped in with quiet offers and tools that worked on the first attempt. A keth'vari nurse named Irely Sohn was struggling with a patient whose airway had been compromised by thermal burns to the upper respiratory tract. The burns had caused the tissue to swell, narrowing the passage to the point where standard intubation was impossible. Irely had tried twice and failed twice, and Vesk could see the panic building in her eyes, the terrible mathematics of a patient suffocating while she held the tool that should have saved him and could not make it work. A human respiratory technician appeared beside her, not pushing, not taking over, standing beside her and holding out a flexible intubation guide with a fiber optic tip that could navigate swollen tissue without further trauma. "May I show you?" the human asked. Irely stepped aside. The human guided the tube past the swollen tissue in 9 seconds. The patient's oxygen readings climbed. Irely watched the human's hands the way Vesk had watched Hasford's, with an attention that was equal parts professional interest and a dawning, uncomfortable recognition that someone had solved a problem she had been trained to solve, and had solved it with a tool she had never seen using a technique she had never been taught. The human left the tool with Irely. Petty Officer Quinn found Vesk again 3 hours into the crisis. He was suturing a scalp wound on a conscious patient, a male keth'vari instructor named Seven who had been on the second gallery when it collapsed. Seven had a concussion, 3 broken ribs, and a personality that refused to lie down. "Your suture technique is excellent," Quinn said, watching from a respectful distance. "Clean loops, even tension." "Who taught you?" "Supervising clinician Owen, the patient you helped me stabilize earlier." "She is good. Her vitals have been steady for the last 2 hours. Dr. Caro is watching her." Vesk tied off the suture and looked at Quinn. She was leaning against the corridor wall, her coverall streaked with keth'vari blood copper green, darker than human red and something that might have been hydraulic fluid from the damaged overhead systems. She looked tired, not exhausted, not on the edge of collapse. Tired the way someone looks when they have been doing hard work for a long time and know they have more ahead and have made their peace with that arithmetic. "How many of these have you done?" Vesk asked. "Deployments 17. Pale Vashari makes 18. 18 emergency medical deployments. Some were emergencies. Some were scheduled support missions, medical infrastructure build-outs, training exchanges, equipment donations. But yes, when the beacon goes off, we go." This was a training accident, a malfunction in our simulation charges. It was not a battle. It was not an invasion. It was our own equipment failing during our own drill. Quinn looked at him with an expression that took Vesk a moment to read. It was patience, but not the condescending kind. It was the patience of someone who had heard this particular confusion before and had learned to wait for the person to finish working through it on their own. "The beacon does not specify a reason," she said. "It specifies a need. You needed help, we were in range. That is the whole calculation." Seven was watching from his cot with the glassy-eyed attention of a concussed man, trying to follow a conversation that kept slipping sideways. "Did I hear that right?" Seven said. 18 deployments. Petty Officer Quinn does, personally." Seven blinked slowly. "And they brought surgery for 17 species to a training station." "Yes, to our training station, where we were practicing how to do the things they are already doing." Vesk did not answer. He did not need to. The observation sat in the air between them like a weight that neither of them knew how to lift. The next crisis came 30 minutes later. A secondary structural alarm triggered in Bay 5. The fire damage had weakened a load-bearing partition, and the atmospheric monitoring system detected a pressure differential that meant the outer hull in that section was compromised. Not breached. Not yet. But the seal was degrading, and Bay 5 still held 4 patients who could not be moved without aggravating their injuries. Vesk was halfway to Bay 5 when he encountered a human engineer, Ruiz, the compact man who had stabilized Bay 7, already coming from the other direction, with 2 crew members carrying a portable hull sealing rig that looked like it weighed more than all 3 humans combined. "We picked up the pressure alarm on our own monitors," Ruiz said, not slowing down. "Your station's hull composition. Keth'vari, laminate over titanium substrate. Standard compact orbital construction. Good, we have sealant rated for that, 20 minutes. The patient's in Bay 5. We'll stay in Bay 5. My team seals the hull first, then we reinforce the partition. If the pressure drops below threshold before we finish, we have emergency pressure shells for up to 12 individuals, keth'vari sized. We brought them. Of course they had. Vesk followed Ruiz into Bay 5. The 4 patients were awake and anxious, their ears flat, their eyes tracking the pressure readouts on the wall panel that showed the numbers slowly, steadily dropping. 2 keth'vari medics were with them, monitoring vitals, keeping their voices calm. One of them, a young nurse named Tessely, was standing between the patients and the compromised wall as if her body could hold back a hull failure through sheer determination. Ruiz and his team went to work on the hull. The sealant compound they applied was a thick, dark paste that expanded as it cured, filling microfractures that were invisible to the naked eye but showed up clearly on the stress analyzer's screen. Vesk watched the pressure readings. The drop slowed, stopped, began to climb back toward normal. 18 minutes, Ruiz had said 20, he had been conservative. While the engineers worked, Quinn appeared in Bay 5 with a human medic Vesk had not yet met, a young man named Tors who carried a portable scanner with an interface that displayed patient information in both Terran Common and keth'vari script. Tors began checking the 4 patients without being asked, running the scanner over each one, cross-referencing their injuries against the treatment they had received, flagging 2 readings that he considered suboptimal. This patient's secondary cardiac output is running low, Tors told Vesk, indicating a female keth'vari officer with burns across her shoulder and upper arm. I can supplement with a targeted stimulant if you would like. It is formulated for keth'vari dual-chamber cardiac physiology. Minimal side effects. Vesk looked at the reading. Tors was right. The secondary output was low, not dangerously so, but low enough that it would slow the healing process and increase fatigue. It was the kind of detail that Vesk himself might have caught in another hour when the acute work was done and the monitoring shifted to recovery optimization. Tors had caught it now, in passing, as a secondary observation while checking on patients who were not even his primary assignment. Administer it, Vesk said. Tors administered the stimulant with a precision injector that calibrated its delivery based on body mass, metabolic rate, and real-time cardiac response. The officer's secondary output climbed within 2 minutes. She did not know what had happened. She did not need to. Tors logged the intervention on his scanner, nodded to Vesk, and moved on. Vesk stood in Bay 5 and watched the pressure readings hold steady, and the patients rest quietly, and the human engineer clean his tools and the human medic log his interventions. And he thought about the word thoroughness, and how he had always believed he understood what it meant, and was now beginning to suspect that he had only ever understood a fraction of it. On his way back to Bay 7, Vesk passed through the station's central corridor and stopped. The Callaway's logistics team had set up a supply point at the corridor junction, a folding table stacked with organized rows of medical supplies, each one labeled in both Common and keth'vari. The labels were not machine translated. They were too precise for that, too fluent in the shorthand of keth'vari medical notation. Someone on the Callaway had learned the compact's medical labeling conventions and had applied them correctly to supplies that had been manufactured on Earth for use on species that Earth had encountered perhaps a dozen times. A young keth'vari medic was standing at the table, staring at a case of wound dressing packs. Each pack was sealed in sterile packaging, with a keth'vari-specific instruction sheet tucked inside. The instructions included not only application guidelines, but aftercare protocols that accounted for fur regrowth over the wound site, a complication that Vesk had dealt with hundreds of times, and that keth'vari manufacturers addressed with a 2-line footnote at the bottom of their own packaging. The human instructions devoted an entire illustrated panel to it. The medic looked up as Vesk approached. "Surgeon, have you seen these?" Vesk had not. He picked up a pack and read the instruction sheet. The illustrated panel showed, in simple diagrams: how to trim fur around the wound edge before applying the dressing, how to position the adhesive strips to avoid pulling on surrounding fur during removal, and how to monitor the wound site for signs of follicle irritation that could indicate the dressing was reacting with the oils in keth'vari fur. Oils in keth'vari fur. They had accounted for the oils in keth'vari fur. Vesk set the pack down and walked away before the young medic could see the expression on his face. The second modular surgical theater saw its third patient at the top of hour 4, a keth'vari maintenance technician named Belly's Own, no relation to Merritt, who had been trapped in a maintenance crawlspace when the cascade breached the conduit runs between bays 6 and 7. Belly's had suffered thermal burns to 60% of his upper body and had inhaled superheated polymer vapor that had scarred his upper airway and was now threatening to swell his lower tracheal passages shut. It was the same type of injury that Irely Sohn had struggled with earlier, but worse. Belly's was larger, the swelling more advanced, the tissue damage more extensive. Vesk arrived at the modular theater's observation window in time to watch Hasford and her team perform a procedure that he had only read about in theoretical journals: a guided microcatheter insertion through the swollen tissue, delivering a targeted anti-inflammatory compound directly to the tracheal wall, while simultaneously maintaining the airway with a flexible stent that expanded in real time based on tissue response feedback. The procedure lasted 22 minutes. Belly's oxygen reading stabilized, his airway held. Hasford dictated her notes to a recording system while her team cleaned the theater, and in her notes she mentioned, casually, that the anti-inflammatory compound had been reformulated 6 months ago specifically for copper-iron hybrid blood chemistries, the keth'vari type, because the original formulation had shown a minor interaction with the copper component in field trials with DALF patients. They had reformulated a drug because field trials with a different species had revealed a minor interaction that might affect the keth'vari. Not a major complication, not a dangerous reaction, a minor interaction, and they had reformulated the drug. Vesk watched Hasford strip off her surgical gloves and reach for a new pair before moving to the post-operative check on Trenny Bask. She did not look up. She did not know Vesk was watching. She was not performing for an audience. She was doing her job, and her job included reformulating drugs for species she might never treat because the possibility of treating them was enough to justify the work. By hour 4, the acute phase was settling. The fires were out. The structural collapse in Bay 7 had been stabilized by a team of human engineers who had come aboard with the surgical teams, carrying portable bracing equipment that they deployed with the same quiet efficiency as everything else. The engineering lead, a compact human male named Ruiz, had taken one look at the collapsed ceiling, run a handheld stress analyzer along the fractured beams, and declared his plan in 12 words. We brace here, here, and here. Cut this, foam that. 45 minutes later, the collapse zone was secure enough to walk through. 26 casualties had been treated. 4 had required the Callaway's modular surgical suites for procedures that exceeded the capability of any equipment remaining on Pale Vashari. All 4 had survived. The dead numbered 3. A keth'vari nurse named Palin Orr, killed instantly in the initial explosion. A technician named Has Yuru, who had been standing directly beneath the cascade point. And a young trainee named Delin Resch, who had been conscious and talking when Vesk reached her, and who had died 12 minutes later from internal injuries that no equipment on the station, keth'vari or human, could have repaired in time. Vesk had held Delin Resch's hand while she died. She had been 19 years old and 2 weeks from completing her first medical rotation. Her last words had been a question about whether the drill scores would still count. She had asked it with the earnest concern of someone who did not yet understand that the scoring rubric no longer applied, and Vesk had told her yes, the scores would count, because the truth would not have helped her, and the lie might have given her something to hold on to in the 11 minutes she had left. He did not tell Quinn about that, not yet. At the far end of Bay 7, Vesk found Irely Sohn, the nurse who had struggled with the airway intubation earlier, working on a patient with degree chemical burns across his forearms and chest. The burns were from the polymer insulation that had ignited in the cascade. They were ugly, deep, and would scar regardless of treatment. Irely was debriding the dead tissue with a precision that Vesk recognized as compensatory. She was being meticulous because she could not afford to be anything else right now, because the alternative to meticulous was falling apart. A human medic named Alvarez was working beside her, not guiding, not supervising, working alongside, matching Irely's pace, handing her instruments before she reached for them, catching the rhythm of her technique and anticipating her needs. They had been working together for less than an hour. They moved like a team that had trained for months. Vesk watched for a moment. Irely glanced up, caught his eye, and said nothing, but her ears shifted forward in the keth'vari gesture that meant acknowledgement, and beneath it, a complicated gratitude that was directed not at Vesk, but at the human beside her who had appeared when the airway was closing and had not left since. He moved on. In the corridor between Bays 6 and 7, Vesk found a scene that would stay with him longer than any surgical procedure. 3 human medics were sitting on the floor against the wall, taking a coordinated rest break. They had 15 minutes, Quinn had told them, and they were spending it efficiently eating rations, drinking water, and reviewing patient notes on handheld displays. One of them, a woman named Patel, was also teaching herself keth'vari phonetics from a language module on her display. "In case a patient wakes up confused," Patel said when she noticed Vesk watching. "Sometimes the first language they remember is their birth language, not common. I want to be able to say something they recognize." She had been aboard keth'vari for 4 hours. She was learning his language so she could comfort his people if they woke up disoriented. The idea that someone would use their 15-minute rest break to learn a foreign species language for a deployment they expected to be over within the day was so absurd and so practical and so profoundly considerate that Vesk had to look away for a moment. He filed it in the part of himself where such things were stored and went back to work, because there were still patients to monitor and equipment to secure and reports to begin, and because stopping meant thinking, and thinking meant feeling, and feeling meant standing still in a corridor full of borrowed human surgical theaters, and trying to understand why a species from a different star system had brought better trauma equipment to a keth'vari training station than the keth'vari military had provided. At hour 5, Vesk found himself in the makeshift recovery ward that the Callaway's team had assembled in Bay 6. The bay had been cleared of debris and fitted with portable cots, atmospheric purifiers, and monitoring stations that hummed with a steady, reassuring frequency. Patients lay in ordered rows. Keth'vari medics moved between them, checking vitals, adjusting fluid lines, speaking in low voices. Human medics moved among them too, distinguishable by their gray coveralls and their unhurried economy of motion. Vesk paused beside the cot of a young keth'vari structural engineer named Dahlan Kresh, who had been pulled from under a fallen beam with a shattered pelvis and a lacerated spleen. The human surgical team had stabilized the spleen, sealed the laceration with that same amber compound Vesk had seen on Owen's femoral wound, and immobilized the pelvis in a lightweight brace that adjusted its compression in real time based on readings from embedded sensors. Dahlan was awake, sedated enough to be comfortable, alert enough to be astonished. "Surgeon Torelli," Dahlan said, his voice thin. "The human doctor, the one who did my surgery. She asked me afterward if the brace was comfortable. She asked me about the fur compression. She said they had designed the brace with a keth'vari sublining specifically because standard braces cause matting in furred species, and the matting leads to skin irritation that interferes with healing." Vesk looked at the brace. It was smooth on the inside, lined with a material that allowed the fur to lie flat rather than compressing it against the skin. He had worn military braces during his own training. They had all caused matting. It had never occurred to him that the problem could be solved. It had never occurred to anyone. The humans had noticed. The humans had designed around it. Vesk ran his fingers along the brace's inner lining once more, then straightened up and moved on. 2 cots down, he checked on keth'vari, the instructor he had resuscitated in the first minutes after the explosion. She was stable now, her dual-chambered heart maintaining steady rhythm, but her eyes followed Vesk with a haunted quality that he recognized as the particular disorientation of someone who had been dead, and was now, improbably, not dead. "Surgeon Torelli," she said, her voice was barely above a whisper. "The evaluators told me later I was down for 40 seconds. Closer to 50. The human doctor Hasford, she came by an hour ago. She reviewed my cardiac readings and adjusted my fluid rate. She said my secondary chamber was compensating for stress damage in the primary. She said it would stabilize on its own in 48 hours, but that I should avoid exertion." Keth'vari paused. "She also told me that keth'vari cardiac architecture is, in her words, elegantly redundant. She said the dual-chamber system is one of the most resilient cardiac designs she has encountered across 9 species. She was complimenting our hearts, Torelli." Vesk did not know what to say to that. A human surgeon, operating on an alien patient she had learned about from a training module, had paused in the middle of a mass casualty deployment to compliment the evolutionary design of the species she was saving. "She also left this," Keth'vari said, and held up a small printed card. Vesk took it. It was a cardiac monitoring guide, specific to keth'vari dual-chamber physiology, printed in both common and keth'vari. The reverse side contained instructions for a self-assessment technique that any keth'vari could perform without equipment, checking pulse through the fur of the throat in 2 specific locations to evaluate both chambers independently. The guide was not part of the Callaway's standard deployment kit. Hasford had printed it aboard the ship during the deployment because she had identified a gap in keth'vari's self-monitoring capability and had decided to fill it. Vesk pocketed the card. Marit Owen was awake when he reached her cot. She was propped up on a folded blanket, her bandaged thigh elevated on a support frame. She looked pale beneath her tawny fur, her eyes sunken with pain and fatigue, but she was alert and her gaze tracked Vesk as he approached. "Torelli," she said, her voice was hoarse, "report." Even now, even injured, sedated, and lying on a borrowed cot in a training bay that no longer resembled a training bay, even now she wanted the report. He gave it. 26 treated, 3 dead. Station hospital still offline, but the human surgical suites were operational. Structural integrity restored in bays 5 through 7. The command staff had confirmed accidental cascade, a manufacturing defect in the simulation charges, the same batch used across 6 training cycles without incident. The defect had been in 1 charge. The cascade had propagated through adjacent charges, in a chain reaction that the safety protocols had not been designed to interrupt. "1 charge," Owen said. "1 defective charge." "Yes." She was quiet for a long time. Then, the humans, how many did they send? 14 medical personnel, 4 engineers, 2 logistics coordinators, and the ship, the Callaway. It is a purpose-built relief vessel. Petty Officer Quinn tells me it carries enough supplies to sustain a forward surgical hospital for 30 days without resupply. For how many species? Vesk paused. 17. Owen closed her eyes. "We invited them to observe our training exercises 2 cycles ago. The request went through the Compact's Foreign Liaison Office. They sent a polite refusal. Said they did not want to intrude on our training sovereignty." She opened her eyes and looked at Vesk. "But they were in range. They were sitting out there, 400 meters off our port side, and they had surgical suites for our species, and they were just sitting there. They carry the suites everywhere, clinician. It is their standard deployment kit. That is what I mean, Torelli. He understood what she meant. He did not know what to do with the understanding, so he adjusted her fluid line and checked her bandage and moved on. At hour 6, Vesk helped Quinn inventory the human equipment that had been deployed throughout the station. It was a practical task, methodical and grounding, and Vesk was grateful for the structure of it. They moved from bay to bay with a handheld scanner that cataloged each piece of equipment, its usage status, and its remaining operational capacity. The list was long enough to feel like an indictment. 4 modular surgical theaters, each capable of independent operation for 72 hours. 12 portable atmospheric purifiers rated for 6 different atmospheric compositions. 64 units of species-specific blood substitute, organized by species and blood chemistry and metabolic rate. A pharmacological library spanning 914 compounds. Surgical instruments calibrated for tissue densities ranging from the calcium-dense bones of Vora to the cartilaginous frames of Pelin to the hybrid skeletal structure of keth'vari. Wound closure devices, diagnostic scanners, a portable imaging suite that could produce full-body anatomical maps in 4 seconds. You carry all of this on one ship? Vesk asked. The Callaway is a dedicated relief vessel. That is all she does. One ship, dedicated entirely to this. There are 47 Callaway-class vessels in the Terran Relief and Neutrality Service. We rotate deployments by sector. This sector has one assigned vessel, us. The nearest backup is the TRNS Auerbach, currently operating in the Daelth border zone. 47 ships, each one carrying this. Vesk stopped in the corridor and stood very still for a moment, the handheld scanner held loosely in his hands, and tried to fit that number into the framework of his understanding. The keth'vari compact had a military medical corps of considerable size and capability. They had training stations and field hospitals and surgical teams and evacuation protocols. They had all of these things, and they had built Pale Vashari specifically to make those things better. And today, when their own station had failed them, a single human ship had arrived and quietly, efficiently, without fanfare or condescension, outperformed every piece of medical equipment the compact had placed aboard. And there were 46 more of those ships. He resumed the inventory. There was nothing else to do. At the end of the inventory, Quinn led Vesk through the Callaway's docking umbilical to the ship itself. He had not expected to be invited aboard. He followed her through a pressurized corridor that smelled faintly of ozone and recycled air, and into a compartment that Quinn identified as the Callaway's primary supply hold. The hold was enormous. Vesk had expected a converted cargo bay. What he found was a precision-engineered storage system with floor-to-ceiling racks of sealed, climate-controlled modules, each one labeled with a species designation and a deployment date. The keth'vari modules occupied one section of one rack. Beside them were modules labeled DAELTH, VORRA, PELLIN, and 3 designations Vesk did not recognize, species he had never encountered, species whose names he had seen only in Concord catalogs and never in person. Beyond the species-specific modules, there were general medical supplies in quantities that made no practical sense for a single-ship deployment. Surgical sponges in cases of 10,000, sterile tubing in kilometer-long spools, suture material in 14 different tensile strengths, each one calibrated for a different tissue type, diagnostic reagents for blood chemistries that the Callaway might encounter once in a 5-year deployment cycle. We restock every 18 months, Quinn said, watching him take it in. The service maintains resupply depots at 6 locations across Concord-adjacent space. Each depot carries a full duplicate of every deployment kit. If we expend our supplies on a deployment, we can restock from the nearest depot and be operational again within 72 hours. The cost, Vesk said. Quinn looked at him. The cost of what? The depots, the supplies, the ship. All of it. The cost of maintaining 47 ships with this level of readiness for species that may never need them. We do not calculate the cost per deployment, Quinn said. We calculate the cost per life. The math works differently when you start from that end. Vesk stood in the hold of a human ship that carried everything, and looked at the racks of sealed modules and the kilometer-long spools of tubing, and the 14 tensile strengths of suture material, and thought about the budgetary meetings he had attended at Compact Medical Command, where procurement officers argued over the unit cost of field coagulators, and whether the next training cycle could operate with 30% fewer simulation charges to save on ordnance expenditure. One defective charge. 30% fewer would not have prevented the cascade. More might have. Better quality control certainly would have. But the procurement officers had not been calculating the cost per life. They had been calculating the cost per unit. He left the Callaway's hold without saying anything more. Some observations were better kept internal until they could be shaped into recommendations that would survive a budgetary review. At hour 7, Vesk found himself standing in the corridor outside Bay 7. The corridor was quieter now. The klaxon had been silenced hours ago. The emergency lighting had been replaced by the station's normal overheads, which gave the hallway a pale, clinical glow that felt too clean for what had happened here. Quinn appeared beside him. She was carrying 2 sealed packets, and she handed one to him without asking whether he wanted it. Field ration, she said. Keth'vari compatible, we carry them. Of course they did. Vesk opened the packet. Inside was a dense, grainy bar with a faintly nutty smell that was not unpleasant. He ate it without tasting it, because his body needed fuel, and the alternative was falling asleep standing up. Petty Officer Quinn. Vesk, she had picked up his given name somewhere in the last 7 hours. The trainee who died, Delin Resch. She was 19. She asked me if her drill scores would still count. Quinn was quiet for a long time. She ate her own ration, a different variety from a different packet, and stared at the wall across the corridor. On my 4th deployment, she said, we responded to a hull breach on a Pellin cargo hauler. The breach was in their crew quarters, 7 Pellin crew, 3 of them children. We got there in 11 minutes. We saved 4. The youngest was 6. She had been in a pressure suit that was 2 sizes too big. The helmet seal had failed. She was alive when we reached her, and she died while I was holding the oxygen mask. Her father was watching. She took another bite of her ration. That was deployment 4. I am on 18. The arithmetic does not get easier. You just learn to carry it without dropping it. Vesk ate his ration and said nothing. The silence between them was not comfortable exactly, but it was honest. It was the silence of 2 people who had done the same kind of work for long enough to know that there were parts of it that words could not reach, and that the attempt to reach them was sometimes worse than the silence. Your team saved people today, Quinn said after a while. Before we arrived, you had already triaged 20 patients and stabilized 7 critical cases with field equipment that would have been adequate for most of those injuries. You held a femoral bleed for 6 minutes with manual pressure alone. Your people were doing the work. Our equipment was not sufficient. Your equipment failed because your station suffered a catastrophic accident. It was not designed to survive. The fact that you were performing effective triage within 3 minutes of the explosion tells me your training program works. You were not waiting for rescue. You were rescuing. Vesk considered this carefully, without the defensive posture that his military training wanted to erect around it, and without the self-effacing diminishment that his exhaustion was offering as an alternative. We were, he said, and then you arrived and you were better. Quinn shook her head. We were more equipped. That is not the same as better. Petty Officer. Your field coagulator sealed a wound in 10 seconds that would have taken me 20 minutes to address surgically, and would have left scarring and required follow-up. Your surgical team opened a chest cavity and repaired a perforated cardiac chamber in 41 minutes on a species they learned from a training module. Your ship carries supplies for 17 species that you rotate based on sector assignment. You designed a fracture brace with a fur-compatible lining because you noticed that standard braces cause matting in furred species. You are better. That is not a criticism. It is an observation. Quinn looked at him. In the pale corridor light, her dark eyes held the particular weariness of a medical professional who has been told they are exceptional while standing in a hallway that still smelled like burnt insulation and blood. "We are better equipped," she said again quietly. "We have been doing this longer. We have more resources. We have a service branch dedicated to this one function. But the moment that matters, Vesk, the moment where the patient is bleeding and the equipment is dead and the ceiling is coming down, that moment is the same for everyone. And in that moment, your people were already working. You did not freeze. You did not wait. You did not sit down. You were on the floor with your hands in the wound. That is not equipment. That is character." He did not know what to say to that. "Dren made it back," Quinn added, "with the coagulators. He arrived about 90 seconds after I did. He ran 4 decks and broke a locked cabinet with a fire extinguisher." "I know. He is 22 years old, and he broke a military supply cabinet with a fire extinguisher to save his commanding officer. I have been doing this for 9 years. I have seen professionals with twice his experience hesitate longer than he did. Dren, shaking hands, running on legs that wanted to buckle, breaking things that were not supposed to be broken, because someone needed what was inside. Vesk filed that alongside the other things he was carrying, and decided that some of the weight was not as heavy as the rest. By hour 9, the Callaway's team had begun packing their modular equipment. The process was as efficient as the setup had been, each unit folding back into its shipping case with practiced precision, each case labeled, each piece of equipment cleaned, sterilized, and logged. Quinn supervised the pack-down in Bay 6 while Vesk watched from the doorway. He had offered to help. Quinn had declined. "We have a system," she said. "It goes faster if we follow it, but stay. I want to show you something before we leave." When the modular theaters were sealed into their cases, Quinn pulled a small data chip from her coverall pocket and held it out to Vesk. "This is a copy of our deployment kit specifications. Equipment lists, training modules, maintenance protocols, pharmaceutical libraries, the 17-species surgical reference database. It is yours." Vesk took the chip. It was small, no larger than his thumbnail, and weighed almost nothing. "This is classified material." It was. The Terran Relief Service declassified the multi-species medical database 4 years ago. Any species can request it. Most do not because most species do not know it exists. "We do not advertise." "Why not?" Quinn's expression shifted. "The database contains information about the physiological vulnerabilities of every species we are equipped to treat. Medical knowledge and tactical knowledge overlap. The Terran government declassified it because the medical utility outweighs the tactical risk, but they left the decision to request it with the individual species governments. We do not push it." "You are pushing it now." "I am handing it to a field surgeon who held a femoral bleed with his bare hands for 6 minutes while his equipment was dead and his station was burning around him. That is not pushing. That is professional courtesy." Vesk closed his hand around the chip. It was still warm from Quinn's pocket. "The Compact will want to review this before it is disseminated," he said. "I know. That is why I am giving it to you and not to your command staff. You will review it. You will understand what it contains. And when your command staff asks whether it has value, you will be able to answer from experience." "One more thing," Quinn said. She reached into her bag and produced a sealed case roughly the size of a field manual. This is a portable training simulator, loaded with the same multi-species scenarios we use to train our surgical teams. It runs on any standard power supply. Your trainees can practice the procedures on virtual patients calibrated to keth'vari physiology before they ever touch a real patient. Vesk took the case. It was heavier than the data chip. It was also, he suspected, worth more than most of the equipment in the training bays they were standing in. You are giving us your training system. A copy. We print new ones every deployment cycle. This one was scheduled for donation at our next port of call, but you need it now. She paused. The simulation scenarios include the thermal coagulation technique I used on clinician own. Your medics can practice it until it is second nature. Next time, you will not need us. The last sentence landed differently than Quinn probably intended it, or perhaps it landed exactly as she intended it. Vesk could not tell, and he suspected that the ambiguity was deliberate. Surgeon Torelli, Quinn said, it was a privilege. Petty Officer Quinn, likewise. She held out her hand. Vesk took it. Her grip was firm, her palm dry and calloused, and the handshake lasted exactly the right duration, long enough to mean something, short enough not to become awkward. Two species, two physiologies, one gesture borrowed from the humans and offered back without translation, because it did not need one. Quinn turned and left. The Callaway's team filed out of Bay 6 in pairs, carrying their equipment cases, their gray coveralls stained with keth'vari blood, their faces showing the controlled weariness that Vesk recognized because he saw it in his own people. The last one out was Surgeon Caro, who paused in the doorway, turned, and nodded to Vesk with an expression that communicated nothing and everything at once. Then they were gone. Vesk stood in the bay. The portable cots were still set up, still carrying patients. The atmospheric purifiers were still running because Quinn had left them. Each one bore a small adhesive label that said complimentary keth'vari atmospheric spec, no return required. They had left the purifiers. They had left the monitoring equipment. They had left 64 units of blood substitute and the pharmacological library and the wound closure devices and the diagnostic scanners and the portable imaging suite. All of it marked with the same notation, complimentary, no return required. Vesk counted the items. He counted them twice. He cross-referenced the count against the inventory he had conducted with Quinn. The numbers did not match, and the discrepancy was not small. The Callaway's team had taken back their 4 modular surgical theaters and their surgical instruments, the classified items, the ones that contained proprietary design specifications. They had left behind everything else. Everything. He sat down on the edge of an empty cot. The data chip was in his pocket, warm against his thigh. The atmospheric purifier beside him hummed its steady note. On the cot across from him, a keth'vari engineer slept with a human-made bandage on his arm and a human-made analgesic in his bloodstream, and a human-made monitoring sensor counting his heartbeats with a precision that the station's own equipment had never achieved. Dren found him there. The young medic stood in the doorway of Bay 6, his fur still matted with dried blood, his hands no longer shaking, his posture carrying the specific exhaustion of someone who had run farther and faster than he had ever believed he could, and was only now discovering that his legs still worked. He looked at the rows of equipment marked complimentary. He looked at Vesk. They left it, Dren said. Yes. All of it. Yes. Are we supposed to send it back? Vesk pulled the data chip from his pocket and held it up to the pale light. A chip, a database. Specifications and protocols and training modules for 17 species, offered by people who had been sitting 400 meters away with exactly the right equipment at exactly the right time, not because they had known the accident would happen, but because they always carried exactly the right equipment everywhere for everyone, on the chance that it might be needed. "No," Vesk said, "we are supposed to learn from it." The keth'vari medical transport arrived 9 hours later. Its trauma team came aboard keth'vari expecting a disaster site and found instead a functioning field hospital with stable patients, clean air, and equipment they did not recognize. The transport's lead surgeon stood in Bay 6 for a long time, reading the labels on the atmospheric purifiers. "Complimentary, no return required," she asked where it had come from. Vesk told her. She did not say anything more, she did not need to. Vesk filed his after-action report that evening. It was thorough, detailed, and exactly as long as it needed to be. Under the section marked External Assistance, he wrote 7 words that he spent 40 minutes choosing. "They brought what we did not have." The report went up the chain. The data chip went to the compact's Surgeon General, who reviewed it, confirmed it was genuine, and issued a directive within the week. The database was to be integrated into every medical training curriculum in the compact. The equipment stayed on keth'vari, where it was folded into the station's permanent medical inventory over the following weeks and months. Dren was promoted to field medic, 2nd class, on the strength of his performance during the crisis. The commendation cited his initiative in securing emergency coagulators under hazardous conditions. It did not mention the fire extinguisher. Dren himself mentioned it at every opportunity for the rest of his career, not as a boast, but as a point of practical instruction. "If the cabinet is locked and the patient is dying," he would tell new medics during their orientation briefings, "the regulations will understand." Irely Sohn requested a copy of the flexible intubation guide that the human respiratory technician had left with her. She received not only the guide but a detailed technical schematic and a manufacturing specification from the Terran Relief Service's public equipment archive, a resource that, Quinn had mentioned, existed freely on an open network that any species could access. Irely spent 3 months adapting the design for keth'vari manufacturing tolerances. The resulting tool was adopted by the compact's Field Medical Corps the following year. In its first 12 months of deployment, it was used successfully in 47 airway emergencies that would previously have required surgical intervention. The atmospheric purifiers ran for 3 years before they needed maintenance. When they finally did, the maintenance instructions were included on the data chip, in keth'vari, translated with a precision that suggested the humans had anticipated the need before the equipment had ever been delivered. Vesk thoroughly completed his field surgery rotation. He rose through the ranks of the keth'vari Combined Medical Corps. He spent 14 years refining trauma protocols based on the database that Quinn had given him, and in that time the compact's field casualty survival rate improved by 11%. The improvement was documented in a report that Vesk authored. In the acknowledgments section, he listed 1 name and 1 ship. Petty Officer Quinn, TRNS Callaway. The report did not explain who she was or what the Callaway had done. It did not need to. By the time the report was published, every field surgeon in the compact had a copy of the 17-species database. Every training station carried atmospheric purifiers built to the specifications on the data chip. Every keth'vari medic who graduated from keth'vari learned, in their first week, a technique for holding manual pressure on a femoral bleed. They learned it from Vesk, and when they asked him where he had learned it, he told them the truth. He had learned it the hard way, on a day when the drills became real and the simulation charges did not care about the scoring rubric. And then someone had arrived carrying everything he did not have, and had left the instructions behind without being asked, and had not wanted anything in return. Not payment, not alliance. Not gratitude, not even acknowledgement. Years later, when Vesk was Surgeon General himself, and the compact's medical corps was training its medics on equipment built from specifications that a human petty officer had pulled from her coverall pocket in a burned-out training bay, A junior officer asked him the question that everyone eventually asked. Why did the humans carry medical equipment for 17 species? Why not just their own? Why spend the resources, the training hours, the manufacturing capacity, the logistical overhead of maintaining supplies for species they might never encounter? Vesk considered the question for a long time. He thought about Quinn. He thought about the field ration she had carried that was keth'vari compatible. He thought about Patel, learning his language on a 15-minute rest break. He thought about Hasford, complementing the evolutionary design of the hearts she was repairing. He thought about the fur-compatible fracture braces and the pressure suit variant and the intubation guide and the training simulator and the data chip and the 47 ships, each one carrying all of it everywhere, all the time, for everyone. Because they decided that was the kind of species they wanted to be, Vesk said, and then they built the ships to prove it. The junior officer considered this. That must be expensive. It is. Then why do they keep doing it? Vesk looked at the officer. He was young, earnest, wearing the silver throat stripe of a field surgeon, 4th rotation, the same rank Vesk had held on the day the simulation charges cascaded. In a drawer in Vesk's office, the data chip still sat where he kept it, warm to the touch from the ambient temperature of the room, still containing every specification, every protocol, every training module for 17 species that a human woman had decided a keth'vari surgeon needed more than she did. Because, Vesk said, the beacon does not specify a reason, it specifies a need. It was the best answer he had. It was the only answer he had ever needed. The Callaway had been 400 meters away. That was always the part that stayed with him. Not the equipment, not the database, not the 47 ships or the 17 species or the surgical suite that could open a chest in 41 minutes. The fact that they had been there, sitting in the quiet dark, carrying everything, waiting for a beacon that might never have fired. And when the beacon fired, they did not hesitate. They did not ask why. They did not ask what had gone wrong or whose fault it was or whether the keth'vari deserved the help or whether the injuries were interesting enough to justify the fuel cost. They just came,